Dr. Carlson, you obviously have a vision with regard to digital utilization in orthodontics. How did your vision fit into the overall plan of Henry Schein Orthodontics?
So I think the digital space is the future of orthodontics, and my relationship with Schein is an organic relationship. It's from people more than anything, more than product, and it's about vision. And so my interpretation of what Henry Schein was doing from an early place was they were looking 10, 20, 30 years out, which is where I think the digital space is going to dominate orthodontics. So I'm in line with that type of thinking. So I want to be around people that are like that.
Explain how the Henry Schein orthodontic team worked with you to help provide everyday clinicians your plan for using digital orthodontics on everything from diagnosis and treatment planning to chairside implementation.
I think Henry Schein puts things together in a way that's thinking about the clinician, thinking about what it's going to be like on the streets when you get back to your office. It's hard to just have a product and put it into a practitioner's office and say, here, I want you to use that, if you don't know the practitioner's individual workflow, whatever that is. Again, I think Henry Schein is just focused on the people and the relationships, and more just trying to make whatever practice you have take that organic step to the next level of practice. And so they seem to have partnered with a lot of companies in terms of new technology and learning new things that seems to be bringing all the digital space together. And I think they just integrate that well, all in one company.
For many uninformed individuals, both clinicians and patients, X-rays of the entire head region may cause concern. How have you and Henry Schein Orthodontics worked to relieve these concerns, and what do you see going forward that would make these even less of a concern?
It's a good question. I mean, I don't think anybody's done like one thing to say this is what's going to alleviate those fears. But I believe that the research is backing up where three-dimensional scans of the head are not actually costly on the dosimetry level, which is where people actually think they are. So the big problem with 3D imaging initially is people thought the X-ray dose was a lot greater than what you did two-dimensionally. And initially with early machines, it was. Machines have progressed significantly in the last 5 years, where three-dimensional scans, like the ones we do in our office, are less dose than two-dimensional traditional X-rays. So if you take a pan and a ceph in a traditional 2D office and compare that dose-wise with what I'm doing in my office, my dosimetry levels, my actual exposure, is less than 2D. It's hard to get that point across, especially to people that aren't going to dig deep into the literature. And you can have somebody like me say it, you can have a company like Henry Schein say it, but until you really get to the facts, people aren't going to believe it. I think what's happening with my involvement with Schein and the educational courses that I'm getting involved with is we're teaching people things, we're creating teaching opportunities that weren't there before. So something like dose, we weren't able to have that conversation 10 years ago. And now there's more and more opportunity where people are discussing it. And I think creating those educational opportunities is where Schein is really advancing.
What support have you received from Henry Schein Orthodontics to help bring to the mass audience the new standard of CBCT ortho in everyday practice? And what do you see on the horizon that really excites you?
So Henry Schein was instrumental in helping myself and my educational partner, Dr. Quintero, bring to fruition our vision of cone beam education. Long before we had any involvement with Henry Schein or their products. They were a new company, we were a new kind of risk. And we wanted to educate the world on 3D orthodontics, because myself and Dr. Quintero were practicing that in our offices for 5, 6 years prior. And we learned a lot, and we really wanted to bring that to the world. And we actually went out to all the companies at an AAO meeting, probably 4 years ago, and we approached everybody and said, here's what we want to do. Who's interested in maybe getting behind this? And Schein was the Henry Schein Ortho was the one company that said, that sounds like a good idea. Let's develop that. What does that mean? Before we had any integration with anything even close to a product, we just wanted to teach people. And they got behind that early, which was a big risk, but I think, again, it was a personal relationship. It's about the people, and those that were involved with our course were very interested in what we were trying to teach, not just what could we sell. And that's what's kept me here. I mean, I just want to be around good people, and I'm going to just go where good people are, whenever that happens.